Alright guys, we're going to go ahead and continue. We're going to get these guys figured out. Forget. And when I say these guys, we're going to talk about the meds, cholinergic, some gynae issues, and then allergy, anaphylaxis. We will start off on meds. So, in terms of, let's break it down to cardiac meds. And a bit on both. Right? So when somebody is having chest pain, you'll hear that just as CP, right? We're now thinking, okay, is this person, is it cardiac or is it pulmonary? Right? So, because everything's all in the same area. Right? Somebody can have like a cough, for instance, and they start to have chest pain because they've been coughing for too long. So you guys want to ask questions, right? Have you had a cough? Is the pain reproducible? Right? So meaning, like if I press on your chest, sir, does that hurt? Does it feel better if I let go? If I lean you forward, right? So positioning as well. You're now thinking, okay, is it possible? Do they have a fever? You're thinking, if the answers here are yes, you're thinking, okay, it's possible that it's more lung related, right? If your answers are no, now you want to start thinking, hey, this is more cardiac, especially if the patient is cool, pale, diaphoretic, right? CPD, cool, pale, diaphoretic, weak, shortness of breath, nauseous, they've maybe vomited, so NV, nausea, vomiting, right? These are all now going to say this is more cardiac related, right? When this is said, you now want to think of aspirin and nitro. Aspirin is going to, if these are platelets, right? This is a vessel, and these are platelets, and then you have RBCs in here and WBCs, so red blood cells, white blood cells, and then the round ones are going to be your platelets. Your platelets they're an important function in clotting, right, in repairing. But the tricky thing about them is that if this person has atherosclerosis, which is basically just trash within their vessel, these guys want to stick to the trash. So if you guys can imagine, now you have trash right here, and that's now making the diameter of this vessel smaller, right? And that could be causing this chest pain, right? Because this muscle over here is used to, we'll say 75% oxygen, right? But now because the diameter is smaller, now it's only at the 60% oxygen. So now you have ischemia, right? So now it's starving for oxygen. So you give the aspirin because it's a platelet inhibitor. So you're now giving aspirin, and if you guys can think that aspirin almost makes like a slick, almost like an oil, if you can think of it like that, right? So now it's just gonna slide over this atherosclerosis, and it's gonna slide over each other. So now if this guy bounces, right, off of this one, they're not gonna stick together. They just continue to slide right on through. And that's why we give aspirin. We wanna give 324 milligrams of aspirin, and we want it to be the baby aspirin. It's a strange name because it's not supposed to be given to kids, right? It's a contraindication. It's only baby because typically it's an orange flavor, right? And we chew it. We chew it because once we chew it and it's that powder, you guys have seen it, right? That powder, it starts working in the mouth. We swallow it and it's already working. If we take now the 325 adult aspirin, we swallow it, right? We don't chew it. And it has like, it has that interesting coating around it to make it slick so we can swallow it and it doesn't get caught, right? So then we have to wait for that adult aspirin to go all the way down to the stomach, right? And now we're waiting 30 to 60 minutes for that to break down in our stomach and then start working.
What if you were to just chew it? It still wouldn't
It's
help a tiny bit.
it will, but it's still going to be solid. The powder breaks apart, right? You can actually suck on the baby ones, like if your person doesn't have their teeth in, they have dentures, right? And they're like, oh, I can't chew. It's okay, sir, just go ahead and suck on it, and it's like candy, right? So that's why we want the 324, not the 325. The nitro is going to be 0.4 milligrams, and that's going to be sublingual. What that does, I heard that you guys were saying that it's a vasodilator, right? And that's because now you have this atherosclerosis, right? This patient now has a decrease in diameter of their vessel. So we want to now open it back up to the normal, right? And if their normal is 75%, cool, that's where we want it, right? The thing is with these, we just have to make sure that they have a good systolic blood pressure, because if their systolic blood pressure is less than 100, right? If it's less than 100 and now we vasodilate, we can take that 100 and drop it to 70 over whatever, right? 70 systolic. If that's the case, that is not going to be enough pressure to feed the brain, right? So we can actually kill this person. That's why we always have to get a blood pressure before giving any of the 3 doses. And it's a max dose of the 3 doses to include what your patient took prior to. So if your patient took 2 before calling and his pressure is still 130 over 90, right? You can give just 1 more and that's it. And we always want to make sure that we're asking, do they take any erectile dysfunction medications, right? And that's because erectile dysfunction medications, such as your Viagra, was actually a blood pressure medication.
So that's the dilator.
Right? It was meant to drop blood pressure. And the only reason is, right, they see, oh, it has that side effect. If now you're vasodilating everything, right, and all of the blood, you're not taking away the blood, you're just making the container bigger. So now that blood is going to pool in areas that can grow, right? And oh, wow, look at that. He has an erection. Perfect. We'll sell more marketing it that way than we will as a blood pressure medication, right? So that's why we're always asking, hey, have you taken any erectile dysfunction medication in the last 24 to 72 hours? Make sense? Are we all okay with cardiac meds?
Has anyone ever accidentally given nitro when it was contradicted because their blood pressure was too low?
Oh, it's happened.
Like, what would you do?
As an EMT, there's really not much. You just pray,
Okay, great.
right? Yeah, you just pray. You put that person in shock position and get to the hospital fast.
What if you're a paramedic?
There's some medications that we can give to increase. We can get a line, right? Give some fluids, give some medications to increase the blood pressure.
You said pray.
Yes. That's it.
And they watch.
To include on here, oxygen's going to be throughout everything. So let me just make that known. So oxygen, we are looking for a decrease in shortness of breath, right? And then a 94% and above. So if somebody has shortness of breath, put them on oxygen, never withhold it, right? Even if their oxygen is at 95%. Okay, let me go ahead and put you on 2 liters. Does that make you feel better, sir? No, I still feel a little short of breath. Okay, well, just to let you know, your oxygen's great. It's at 94%, 95 right now. I'm going to go ahead and just put you up to 4. Give them a couple of seconds, right? Does it feel better, sir? Yeah, now I feel better. Okay, sir, just to let you know, you're on 4 liters of oxygen, right? Which isn't too much, but we're at least going in the right direction. Never withhold. 94%, so now if this person, let's say, is on 2 liters of oxygen and they're like, oh, wow, I feel a lot better, right? But they're only at 92, crank them up because you have to get them to that special number of 94. Cool? Let's see here, cardiac, we're all good there. Let's talk about allergy, anaphylaxis. Allergy anaphylaxis, we're going to think about epinephrine. Epi, we're gonna think about a metered dose inhaler for your guys, right? And we're gonna always ask if they took over-the-counter OTC Benadryl, right? Before you got there. When we're thinking of allergy, alert, or anaphylaxis, we're appreciating that now this allergy, this histamine, has now gone too far, right? It's now an exaggerated response. Is it possible that you can just have an allergic reaction out of nowhere? Let's say, for instance, you've eaten peanuts your entire life. Today you have peanuts and you have an allergic reaction to them. Is that possible?
Mm-hmm.
Absolutely, right? Happens all the time. You have people from like Louisiana, for instance. Oh, I've grown up on crawfish, right? How am I allergic to shellfish? Your body just reaches a threshold. Says, oh, no more, right? Happens all the time. 20 years I've been eating crawfish. Now you're saying that I have an allergic reaction to it to the point that I can die and I now have to have this EpiPen, right? Happens all the time. So, with this said, this person is going to be cool, pale, diaphoretic. They're in shock, right? When they are having an anaphylactic situation. If it's just an allergy, they can have shortness of breath, right? An itchy throat, watery eyes, right? Maybe a little bit of a cough. If you guys know of anyone who's maybe allergic to cats or dogs, right? That dander, right? Or just everyone's allergies now. Gosh, red eyes as well. Put red, watery. With all this wind that's going around, there's been a couple of days that you can actually see the pollen moving in the air, right? This is going to be allergic reaction, right? When you now move into anaphylaxis, they're now going to be cool, pale, diaphoretic. This is now a shock. Because what's happening here is your vessel, your blood vessel, is now dilating, right? This blood vessel is now dilating with no change of volume. You're not getting more blood. Your vessel is just getting big, right? If you guys can imagine like a coax cable, right? Like let's think of a high-end coax cable. High-end like the Monster where it's braided, right?
Mm-hmm.
Have you guys ever played with that braid? You push it together,
Mm-hmm.
right? And it gets bigger, the braid. Same thing if you guys can imagine that being our vessels, right? As now the vessel gets bigger, that braid gets bigger. So it should be like this when it's nice and closed, right? But now as it's getting larger, you're now having these little holes. And that's going to be increased permeability. For now, let's, in these little holes here, right? You now have liquid that is seeping outwards, right? This is now causing that third spacing, so that edema and that low blood pressure. All of this is still happening. This is now just an addition to. This is now an exaggerated response. You want to ask if they have an EpiPen, right? If they have a history of this happening, they're going to have it, hopefully, right? If this is their first time, they don't. And you just have to have ALS because we have our own epi. With this here, the EpiPen for an adult is going to be 0.3 milligrams, and your pediatric is going to be half of that, so 0.15 milligrams for your peds. You're going to go ahead and take the cap off, right? And you can go right through, close, holding it 10 seconds, allowing for all of that medication to come out, right? And this person has to be monitored for their SpO2, right? If they're cool, pale, diaphoretic, anytime they're going to be on at least a non-rebreather, if not being bagged, right? They're more than likely going to have, due to that cough, right, that shortness of breath, they're going to have wheezing and possibly stridor, which is going to be the upper airway constriction at the trachea, right? The wheezing is going to be down at the lungs, lower airway. With that said, you're now going to ask them if they have a metered dose inhaler of their own that you guys can assist with, right? If they have it, assist them. If they don't, right? They need it. Make sure that ALS is coming.
Gotcha.
Cool?
Why do you think that, just EMT can't use these epi and the microdose inhaler? It doesn't seem like it would be.
You're assisting with it.
Right,
You're assisting, and that's because epi is a very potent drug,
okay,
right? And then meter dose inhaler, they have to be, this person is going to be diagnosed prior to, right, with asthma, right? Some sort of bronchoconstriction disease,
okay.
right? So at this point, saying, oh, I think this is what's going on and this is what I'm going to rule out, right? You just need a little bit more education. Make sense?
What does OTC stand for?
Oh, so we're going to go over that right now.
Oh, okay.
Over the counter,
Over the counter.
Benadryl. You guys can buy Benadryl over the counter, right? They come in 25 milligram little pills. And sometimes people will be like, oh gosh, I think I have an allergic reaction to that peanut butter that I just ate, right? Hey mom, can you go ahead and go to the store and get me some Benadryl? And they pop 2, right? You always want to ask if they took anything prior to you getting there. This right here is a perfect time to talk about the cholinergic versus anticholinergic. You see here, red, watery eyes, coughing, right? When now we have a histamine response, right? We now start to ooze, right? A runny nose, watery eyes, coughing, right? You have some sputum that comes up, right? Everything starts to ooze. That is a cholinergic response. You're oozing. Anticholinergic is going to be Benadryl. Have you guys ever taken Benadryl? Yes? No?
Makes me super tired.
Makes you super tired, very drowsy,
Yeah.
right? And then maybe the night, maybe you took it to try to go to sleep a little better, right? Allergic to cats, however you're using it, and you feel like you need to now drink like a gallon of water, right?
Yeah.
Because it dries you up, right? It dries you up because of these red watery eyes, that cough, that runny nose, right? Anticholinergic,
That's what Benadryl
anti-ooze.
is.
What's that?
That's what Benadryl is.
Yes.
An anticholinergic.
It's an anticholinergic, antihistamine. Does that help you with your question earlier for cholinergic?
Yes,
Cool.
definitely.
All
So it
right.
dehydrates you, in a sense.
In a sense. In a sense, yes. And again, we're just making sure that SpO2 and that shortness of breath is handled.
So we can't give Benadryl?
You guys do not have Benadryl at this point. When you guys get to AEMT, you guys can give it. So at this point, just get into the habit for all of your allergic reactions, anaphylaxis, asking if they took it over the counter.
Okay.
Cool? So
But if they did take Benadryl already before you got there,
it's good to know, right? And then if they just took it, you want to anticipate that they are going to become drowsy, right? So staying ahead of them.
at what point would you suspect that they might need something more like epi?
Oh, once they're cool pale diaphoretic.
Oh, okay, got it.
If they're cool pale diaphoretic, any airway involvement that they can't speak or their tongue is huge, right, with angioedema, epi.
Got it.
Don't even think about it. Epi. Hopefully they have it nearby. For ODs, we're going to talk about Narcan versus activated charcoal. Your Narcan is going to be for narcotics. Right? These are going to be downers. These are going to be your morphine, your fentanyl, right? Your heroin, right? Where the person is chasing a high to feel like an out-of-body type of situation, right? These patients are going to have depressed, right? So low respiratory rates, pinpoint pupils. A normal pupillary size is about 3 to 4 millimeters, right? These guys have like a 1 to a 2 millimeter. They're like little pinpricks, right? And they don't get any bigger. And they may be altered to the point that now you try to elicit a painful response and nothing happens, right? Altered. If you guys can imagine, this is now brain tissue, and these are all little receptors. right in here in these little grooves. Imagine now this person took heroin. So now you have heroin going all around the brain. As now it sets, and this is now where they have that high. Right? Let's say typically they don't take as much heroin, or they take it from another dealer that's cut with something else, right? So not all of these receptors are usually involved, but today you're there and they are. So this person is breathing at 4 times a minute. They are altered. You can't elicit any painful response, right? You need to now help them with Narcan. They have their own Narcan because they're a known heroin user. When you give Narcan, you now allow that Narcan to be heavier, and it bumps out that heroin out of this receptor, right? It bumps them back out. And I draw it this way for a purpose. We do not have to have this person awake and alert talking to us because this person is an addict, right? And they're chasing that high and they paid good money, right? So if now you steal their high from them, do you think they're going to be pissed off?
Yeah.
100%, right? There's no need to be talked to badly in the back of a truck, right? They will cuss at you, wish death upon you, your animals, your kids, everything, right? Because you just messed up their whole entire life, even though you helped them. So all you want to do is just give them enough to bump out just some to now bring that 4 respirations a minute to 10 to 12, right? Hey, let's go ahead and let's just bump you up. I don't want to steal your high. I just want to keep you alive. Make sense? And then you guys may have to give it again. Because if now, depending on how many H's are out here, right, they may continue to fall and now bump the Narcan out. Right? So you may have to give additional doses. So whenever you guys give Narcan, they have to go to the hospital, even if they come up. And they're like, oh my God, did I take too much? Yeah, man, you took too much, but you look good right now. Okay. Yeah, this is the 2nd time in the last week, right? I was just in the hospital for 2 days. I don't want to go to the hospital again, right? They have to go.
Okay.
Cool.
Gotcha.
So this makes sense to you guys?
Yeah.
Narcotics. For activated charcoal, this is going to be for solids, right? Ingested within the last hour. If, let's say, I'm a 5-year-old, right? And for whatever reason, I thought that shea butter, right, tasted good. So I ate an entire tub of the shea butter. And now I feel nauseous. Is that a solid?
Mm-hmm.
Shea butter?
Oh, no, no.
No, it's not a solid.
It's not solid.
So you would not give activated charcoal,
Oh, okay.
right?
Okay.
If I'm a 2-year-old and mom walks in to see that I have now eaten an entire tub of Vaseline, would I give activated charcoal? No, not a solid, right? If now I'm that same 2-year-old and mom left her Xanax open on the side table, right, her nightstand, and kid has now ingested half, right? Mom's counting out, oh my God, I'm missing half. She's looking all over the floor, right? Can't find it. Oh my God, my kid just ate this, right? Calls 911. It's within the hour. Is that a solid?
Yeah.
Yes, I give activated charcoal. Do you guys see the difference here? Cool. Your Narcan dose over here is going to be, for you guys, 0.4 milligrams. And your activated charcoal is going to be 1 milligram per kilogram max dose. And this is going to be your adult of 50. So your adults get 50. Your kids will get 1 milligram per kilogram. And right here, this is only going to be given for your adults at this time. because your adult's gonna have this. They're gonna have their own Narcan that you can just assist with. All good here?
Mhm.
Yeah.
Alright, I think it's just oral. Oral glucose, I think. So the Am I missing any other medications for you guys?
I'm trying to think, I don't think so. Just the glucose.
Right?
Yeah.
Alright. Oral glucose. If this is your vessel, right? Your cells are over on the outside. And your glucose are going to be huge molecules, right, that come on in. And then the insulin allows almost like a little portal, right, to open for those big glucose molecules to go through and now feed the cell, right? That's going to be a normal, healthy person, and that's all depending on what you're going off of. You'll see 70 or 80, right, as the lower threshold, and then to 120, all depending, and it changes. Sometimes you'll even see 60 down here. But from like hospital to hospital, they have different parameters. It's a little hard to follow, especially when you're brand new, not understanding like who's who. If now this person, let's say, is fasting, right? That's the new thing for people to do to lose weight, intermittent fasting. So they're only eating, let's say they're doing a 20 and 4. So they're fasting for 20 and they're eating for 4. And let's say when they're eating for 4, they're doing the keto, right? So they're not having any carbs or very little. And these people, these happen all the time, right? They want to lose weight. They're trying to make some sort of goal. So they're also doing an hour of cardio. And they're only ingesting, we'll say, 20 grams of carbs throughout the day, right? And then this is on top of their normal daily activity. When you get there, this person is awake, right? Is alert, but not oriented. It's totally possible to be awake and alert, not oriented, right? Somebody walks in here, lethargic. Oh, hi. Right? You guys are my friends and you're like, something is wrong with her. This is not normal. That's why we called, right? We've been with her all morning. She hasn't been drinking. She hasn't left to do any sort of drug, right? She's just been sitting here teaching, right? But she's getting more and more lethargic, and I don't know, we're just concerned. So you guys come here and you're like, okay, I'm talking to you, I'm able to swallow my own secretions. I'm not drooling, right? If I'm sitting here drooling and I'm like, and then you come over to me and you're like, hey, are you awake? Oh, yeah. Right? And there's drool. Do you want to put anything in my mouth?
Mm-hmm.
Right? The chances of me aspirating, right? If you guys were to put now the oral glucose in my mouth at this point, and I go, what's that? Right? And now I just breathed in, I just inhaled all of that glucose, and now it all went into my lungs. Right? So you don't want to do that. You want the person to be awake, alert, able to swallow their own secretions. And then you'd give this, right? And this is going to be for hypoglycemia. This person can just be hypoglycemic without a history. So this person right here, hypoglycemic, right? They have a good functioning pancreas, right? It's not an insulin problem. They're just not eating a lot and doing a lot of physical activity. So hypoglycemia. Or this person could be a diabetic where they overcorrected on their insulin. They took too much insulin and didn't eat enough, right? Oh, I just took 10 units of glucose or of insulin, and I was actually on my way to the restaurant, but my mom called and is upset with me. So we started having some sort of argument, right? Adrenaline goes up, right? All of that insulin's going. I'm not eating, right? Sugar drops. I'm still talking, right? But now I feel weak. I feel like my head hurts. I can't really see, right? Check the sugar. Go ahead and give that person who's also a diabetic. Does this make sense to you?
Mm-hmm.
Could be both hypoglycemic or a diabetic.
So,
And just to let you know, your diabetics who are hypoglycemic, this is going to be important. Hypoglycemic is going to be cool, pale, diaphoretic. Okay? Hyperglycemic. So let's say this person hasn't had their insulin in the last week because they lost their insurance, right? And now their sugar is 600. That person is going to be warm, super dry, and flushed. Cool.
so the difference between hypoglycemic and diabetic has to do with not being able to create insulin
Correct.
or just taking too much insulin
Mm-hmm.
coincides, and hypoglycemic is just not eating. Is that,
Yeah, not having more more output than intake.
and that's not like a medical condition. That's the person's fault because they didn't eat enough.
Or maybe they're just not, I wouldn't say fault.
I mean,
Right.
they did it.
Yeah,
They made it happen.
self-inflicted, I guess you could say.
Self-inflicted is,
Yeah.
yes. Okay.
Cool. All right, going into gynae issues. Let's know. What was the other one I saw in there? Okay. With ovarian cysts, what are we thinking is happening? Should be good. So this is your uterus, right? Fallopian tubes, ovary, right? Here's your cervix down at the bottom. Ovarian cysts, these are your ovaries on either side, and you can have both, right? And cysts are common, right? There's nothing abnormal about them. It's just if you have many cysts, right? You guys will hear the term PCOS, which is polycystic ovarian syndrome. And anything that's a syndrome is now going above and beyond what it should be, right? So you can have now an ovary that is littered with cysts, or you can have an ovary that has a ginormous